this on YouTube?
Make him famous.
Well, that's fine.
Probably-
Might
probably-
run into HIPAA violations. You might want
Yeah,
to.
there's-
Okay, yeah. All right. I swear not to put it on YouTube.
So let's see. No, so he came in on the late on the 15th. And
Like at
his
3 a.m. or so, right?
yeah, his first troponin was 2.78, and then it went down after that.
So
And what time was that test?
That was the next morning. So he may have had a point of care in the emergency room. Let me see that.
I may
So
have
it looks
missed
like that was 7:25 on the 16th.
7:25 p.m.
AM.
a.m. The 16th. Is that Tuesday?
So let's see. Here's one. Okay, yeah, you're right. So on the 15th, it was negative. So, and you know, troponin levels start going up in about 6 to 8 hours.
I know there's a delay.
After the,
There's a
after-
lag effect, yeah.
So
So it's
So
unknown.
if it was 2.78 at 7:25 a.m.,
Yeah.
then that means the event was probably, when he came in or shortly thereafter.
I wasn't here, but by his report and by my son's report, who was here also, for that 1 p.m. Incident on Monday, he was, I mean, my son was scared for him. He didn't think he was dying, but he thought if it got any worse, he was going to, So I'm just saying that might have been an attack. And maybe it's a moot point. He did have an attack,
Some kind.
and we found that there's issues, and now we got to decide what to do from here. But
Well, I think it's clear that, it's a pretty fine line that he's got to walk.
yeah,
Right.
He can't go far either one way or the other without getting into big trouble. So
I understand
I
that.
think the question is, can we keep him on that fine line for a while longer?
Right.
Daddy, do I have your permission to ask what I usually ask doctors or construction engineers or whatever that I'm dealing with? Can I ask that question? What would you do if you were me?
But I've
Is
already
it-
thought of that. And that's hard.
Or what would you do if this was your daddy? Either one,
He asked that question earlier.
Mhm.
That was before I really had sat down and
Yeah.
reviewed his films. I think that's a very difficult choice, and I think it really depends on his wishes
Mhm.
more than what we can technically do.
Right.
If he was...
You know,
I think you're having a heart attack, Daddy.
It looked like it was on.
Do you want me to call the nurse?
Maybe it's probably the batteries.
Yeah.
That's probably it. Yeah. Do you want me to let the nurse know?
He's not plugged in, that's what it is. So I think when you're 90 years old, you kind of get to make different decisions than you would if you were younger.
I'm
And,
keenly aware of all of that. And I know that I'm not going to get better at this age overall, because of age and the way the body ages and different parts of the body age.
Yeah. And I think that's the tough thing is, you could fix the artery, and because he's 90 years old, he still might not survive 2 or 3 more years.
Yeah.
So, some of it's more based on quality of life issues than length of life issues. And that's why I think, he's done pretty well in the last few days. And I think we'll know more as you get up and are more active.
Sure.
So I think it wouldn't hurt to see how you do on medication
Right.
and go from there. Now,
Now,
His,
if
his
we-
blood pressure's been pretty low. It looks like last night his blood pressure kind of dipped down to 89/58. So there's going to be some limitation on what we can do from a medication standpoint.
If I can talk way over my head for just a second, you mentioned drilling out some of the calcification,
Uh-huh.
right? Which is the blockage, right?
Right.
What about doing that without a stent? And I'm talking way over my head here.
Not a good idea.
Okay. It was a
That's-
stupid question, I know, but
Yeah, it's not a definitive treatment. It's a way to modify the plaque
right.
to make the stent procedure go better.
Okay, but it's not a procedure in and of itself.
No.
Okay.
In fact, it was very popular.
I mean, you see why I asked that.
Yeah, it was very popular for a period of
Oh,
time,
really?
where you go in and you just
Clean the
bore,
sludge
bore
out.
out the plaque and
Right.
then you balloon it. And this was back really before we had stents.
Mm-hmm.
And people were looking for other devices that could get you a better result. And it might make the result look better, but the recurrence rate was much higher
I
than
got
if you
you.
just blow up a balloon in the artery.
Right. Okay.
And so a lot of these niche devices really fell off the radar because they didn't do any better than just blowing up a balloon in the artery.
Right.
And then when stents came along, stents really changed the game as far as reducing complication risk and the risk of recurrent blockage.
Gotcha.
So,
Okay. Sorry to backtrack.
Daddy,
okay.
if,
We were talking about the medication route, so.
if we did decide to do the stent, you've been off Coumadin for a couple days. I mean, if we did do the stent, you would say we should go ahead and do it. Is that what I'm
well, I mean, I
understanding
think
from
we
that?
can always come back to that decision.
Okay, all right.
The fact that he's been off of his Coumadin, you know, if we decided to go ahead now would be a good time. There's no reason to wait another 3 or 4
Right.
days. But, you know, if he doesn't want to go that route, then I think we would go ahead and resume his Coumadin. And it's going to take a few days for it.
And go home or keep him here?
Well, I think I would probably keep him on the IV heparin until he's therapeutic on Coumadin.
Right.
Okay.
And then, you know, that would also give us the opportunity to see how he's doing.
See how
now.
he does.
Now,
Okay.
part of the reason his blood pressure's low is he's been getting diuretics, you know,
Mhm.
Right.
twice
That's
a
true,
day
too.
IV.
Right.
So he's a little bit on the dry side right now. And that would be reflected in his pressures as well. Yeah, so he's a little bit dried out now, and that'll lower his blood pressure. So we could go ahead and switch his diuretics over to oral and back off on the intensity of it. So that would help with his blood pressure. He's also taking lisinopril, which is a good medication for most people for heart failure. But I think he may do better with more anti-anginal therapy than lisinopril. So we may be, there are some changes I think we can make in his medications that
Okay.
may be beneficial for him.